Hello, my name is Leah. I'm an audiologist at West Virginia University, and my colleague Christina is a speech language pathologist.
Hello, it's nice to see you all today virtually. We're happy to be here.
Can everybody online hear us okay? If a thumbs up is available to you or a...
We can hear you.
Excellent. That's great news. Well, first, we just want to say thank you for having us here. Oh, sorry about that. We just want to say thank you to everybody for having us here. We're really excited to come and talk to you today, and we'll just jump right in. So the joke is I'm an audiologist, and you say, what? Huh? What did you say? Yeah. As an audiologist, I test hearing and treat hearing loss. We can test balance and dizzy complaints, manage tinnitus, which is ringing or buzzing or sounds in the ears, and work with different types of communication technology, including hearing aids. On the screen, you'll see 3 pictures from our brand new clinic. We just opened up under the School of Medicine. What you can see is where we work with communication technology, as well as 2 of the patient sides of our booths where we test hearing. And what we're hoping today is to share with you what we do and what the clinic is all about, in hopes that maybe if you're having any problems or questions, you'd feel comfortable coming to see us. So I'm not sure if anybody's ever felt this way, but the most common complaint that we hear as audiologists is I can hear, but I can't understand. And what you're seeing on the screen right now is a very basic model of how we hear. So sound comes into the ear, hits the eardrum, wiggles those little bones, and sends the signal to that snail-looking organ called a cochlea. In the cochlea is where nerve damage can occur, and hearing loss as a result of nerve damage causes the I can hear, but I can't understand. So that clarity element of hearing that often people experience, maybe you feel like everybody is mumbling, maybe in a crowded room, you have trouble understanding the difference between the word bat and pat. Those sorts of things are happening out in what we call the high frequencies, and that happens as a result of nerve damage. So when I say high frequency, I want you to just take a quick look at the picture on the screen. This is called an audiogram. It is a picture of hearing. On the bottom, you'll see it says frequency in hertz, and what I want you to take away from this is the X's and the O's look a little bit like a slope, kind of like a ski slope. They're higher on the picture on the left side and lower on that right. Or, well, I guess it depends on which way you're looking at it now that I'm turning myself around. But the higher the X's and O's are on the picture, the more normal. You can see where it says normal hearing, and the lower the X's and O's are on the picture is more severe. And across the bottom, the lower pitches are, if you think of keys on a piano, the left side of the piano versus the high keys on the right side, or that 8,000 would be your higher frequency. What we're seeing here is that the hearing is better in the lower pitches and worse in the higher pitches. And the higher pitches is where clarity of speech occurs. This is where consonants are happening. And that's where the complaint of I can hear, but I can't understand comes from. This is the most common hearing loss that we see, resulting from either aging or noise exposure. Some medications can cause high frequency hearing loss. It's also very closely associated with ringing or buzzing or sounds in the ears that we refer to as tinnitus. And so there's often signs of this type of hearing loss occurring that people often don't relate to what they consider to be hearing loss, which is I can't hear anything. That's less likely the case. It's more of a clarity thing typically. So you might ask yourself, should I see an audiologist? And if you're considering it, I do have a survey that I can share, which if you score a 6 or higher, it might be time to see an audiologist, which I'll definitely leave. But some other ways that you can determine if you need to see an audiologist are the questions I have here. Do I have trouble hearing? Can I hear but have difficulty understanding? Do I have ringing, buzzing sounds in my ears that other people aren't hearing? Do I already own hearing aids, but they don't seem to be working well for me anymore? Or do I have a history of loud noise exposure? If you're answering yes to some of these questions, it's not a bad idea to at least have your hearing tested to know where you're starting. These are the audiologists that we have at the WVU clinic. Dr. Nancy Arts and Dr. Kenneth Morris are both PhDs, and so they find themselves in the clinic a little less often, but still in the clinic. And myself, Leah, I am the full-time clinical audiologist. Kenny and I are married, so that's why we have the same last name. And he actually is studying tinnitus. So one of the benefits of coming to see the three of us is you can be treated clinically, you can participate in research to pursue better advancements in the field, and we have students with us here today who we are training to become audiologists as well. And so when you come see us at WVU, there's a lot of benefit for everybody involved. So we are going to have an opportunity for questions at the end, but if anybody has a question, I'm happy to answer before we move on to talking about our speech and language services.
Okay. And just like Leah said, so I'm Christina. I'm a speech language pathologist. Leah and I both work in the WVU speech language and hearing center. So we actually work right down the hall from each other, which is wonderful for collaboration and care and everything. But before I move on to the next, pieces of information that we wanted to talk about, I just wanted to give you a little bit of context. We're really excited because we actually just opened this clinic this past spring, and part of our goal, we're part of the academic department within WVU. So we have students with us today, we have students with us in clinic, and our goal is to really provide the best care possible, both to provide the services to the community as well as teach our students. And there's been a huge investment in the clinic. So some of this is to share that information. But if you have questions or an interest in anything that we bring up, please just shout it out. You don't have to wait. We'll hear you. So I wanted to invite you to do that as well. So I am a speech language pathologist, like I said, and before I talk about speech language pathologists, I guess, and I can ask here or in person or on Zoom, has anybody interacted with or been familiar with speech language pathologists in the past? Speech pathologists are talkers. That's why we got into speech and language for a living. But the reason that I ask is that there's often, a lot of people are often familiar with the speech therapist, like in the school system. You have kids who might be learning how to talk and read and do all of that, and they're having trouble communicating, and you see a speech pathologist there. But what a lot of people don't know is that speech language pathologists work with adults across really the entire lifespan. So I'm just sharing a little bit of that information with you today. So speech language pathologists diagnose and treat problems with speech. Like I said, in speech, when we talk about speech, we're talking about making the muscles move to get the words out, which we separate from language. Language is thinking of the right word, stringing a sentence together, those sorts of things. So people sometimes have complaints that the words won't come out, but sometimes it can be thinking of the word, and sometimes it can be actually making the sounds, that actually produce the word. So speech and language problems. We also work with people who have voice problems. When I say a voice problem, I mean hoarseness. It doesn't actually have to be hoarseness. It can be fatigue in your voice or just trouble getting sound out in general. But speech language pathologists do voice therapy and voice evaluations to help people with voice problems. We also work with swallowing, which is something that is not commonly associated with speech pathologists, but it's a big part of our field, and it can be a really debilitating issue if you have trouble swallowing. Just imagine the number of times you try to socialize with someone. How often does that include eating? Most of the time, right? So we go out and we grab a coffee with someone, or we do lunch, do dinner, come over, I'll have some snacks, and that kind of a thing. So anyway, so we deal with swallowing problems, and of course, like I said, childhood speech issues, which are very important as well. But just highlighting the whole range. But the bottom line is, if you have trouble communicating in any way, a speech language pathologist might be able to help, and it could be important to reach out. So let me talk in just a little bit of detail about um, voice and hoarseness and swallowing issues, just to give you a little bit of information. Um, those are my areas of expertise, voice and swallowing. So I'm happy to talk more about that in detail, or really anything else. But hoarseness issues. So one of the things that we know, when I say hoarseness, like I said, I mean the voice. If you put your hand on your throat, you can feel that buzzing. That's your vocal cords working to make sure that you can get a nice sound quality coming out. But as we get older, there are changes that happen really in our whole body, which I think everybody is aware of. But there are changes that happen up here, like in your head and neck area, and that can affect both voice and swallowing. So that we know about 29% of people who are over the age of 65 actually report having voice problems. And this happens mainly because the vocal cords themselves are muscles. They actually contain muscles in them. So we know that the muscles in your arms change, right? The muscles in your face change, that sort of thing, as we get older. And so do the muscles that make up the vocal cords. So much that in many people, it can actually cause hoarseness or fatigue or those sorts of things. So it is common. And I say that just to normalize the issue, because I think oftentimes people think, oh, well, it's just how it goes. Things change and you just keep on with your life. And you can certainly do that. And that's fine. But there are ways to help, so that if you're not able to use your voice as you once did, there are ways to get you functioning better. And that's why we're here. But signs of a voice problem could be that people have found it difficult to hear you. Maybe you've gotten comments that people think you're sick all the time, or your voice becomes really tired. So maybe once you could talk for 2 hours at a time, and you love to talk to big crowds for some other purpose. And now you just can't do it. Your voice won't hold up that long. These are some common things that we hear when people are having trouble with their voice. And in general, any voice issue that lasts more than 2 weeks is considered a voice disorder or a voice problem. So that's just a little bit of information about voice and hoarseness. Swallowing also changes with age. Again, it has to do primarily with how the muscles change. The muscles in your neck and in your throat, and even our breathing changes, which we don't think about, but the way we breathe can change as we get older, and how you breathe impacts how you swallow. But there's a range of reasons. And about 15 to 22% of people who are over the age of 50 do report having trouble swallowing. So again, signs of a problem, oh, my slide says voice problem, I apologize. Signs of a swallowing problem are, of course, coughing or choking when you're eating and drinking, that sounds pretty obvious, right? That sounds like there would be an issue. Or if you get a gurgly, like wet vocal quality after you eat, that could mean that food or liquid's going down the wrong way. Repeat lung infections. This is one that people don't often think about, but it can happen if you get pneumonia all the time. Then sometimes there are some pneumonias that can be linked to problems swallowing. And that's one of the main reasons that we actually evaluate people for swallowing when they have many different medical conditions. And of course, people also feel like food is sticking in their throat. So these are all symptoms of swallowing problems. Here on the slide, I have a picture. Like I said, our clinic has undergone a big investment to make sure that we're offering the highest possible services to the community and for our students. And one of those services that we bought the equipment and we're developing, and it's something that I actually have experience from in past uh, opportunities, both up in Pittsburgh and up in Henry Ford Hospital in Detroit, is doing a certain kind of evaluation of swallowing that involves actually looking into your throat. And that's what this scoping tower is here in the corner. So we're very excited to be offering all of those services as people have problems coming into the clinic. And just to give you a glimpse, if you did have swallowing problems, these are two of the exams that are sometimes done. This one on the left, it looks like an x-ray because it is an x-ray. It's an x-ray of swallowing. So sometimes when people have swallowing problems, we'll ask to do what's called a modified barium swallow study. And when we do that, you can actually, what I'm pointing out right here, this darker image, is actually it's liquid barium, but it's what the person does is eat and drink stuff that has this chalky white barium substance, and then it shows up on the x-ray. So we can actually watch the food and liquid go down your throat and see what might be happening. But that's what this x-ray image is here. This big white space is your throat, and that space in the middle is actually called the pharynx, which is where that food and liquid goes. The image on your right is a different kind of study. It's a scope. So we call this a fiber optic evaluation of swallowing because we're literally looking with a camera. And this right here, these are your vocal cords, if you can see where I'm pointing. What I was saying is these are two different evaluations of swallowing. The one on the left is an x-ray of swallowing, where you can actually see someone eating and drinking barium. So we can diagnose problems that are happening there. And the one on your right is where we actually put a camera in your nose and watch you eat and drink as you're swallowing. And that's what you can see here. This is, I'm not sure what the substance is here, but I think it's milk. But anyway, you can see that it flows into your throat and we can watch where everything is going. This little dark spot right in the middle is actually the, as I was mentioning, on the right here is an endoscopic view of swallowing. Like I was saying, and right in the middle, there's a dark spot, and that's actually the passageway to your lungs. That's the start of your trachea and actually heads down the whole way into your lungs, which is why breathing and lung infections are associated with swallowing. But that's just a little bit of information about what we do. The question then is, where can you find a speech language pathologist? Just like where you can find an audiologist. Like I said, right down the hall from Leah. So at our center at the WVU Speech, Language, and Hearing Clinic, we have many different providers. We actually have 6 speech language pathologists, but other than who I have on the screen, or not other than, but including the ones that I have on the screen. But the other speech language pathologists primarily work with children. And today we were just talking more about issues that affect adults. So these 3 people, Dr. Anna Gravlin, Dr. Kimberly Me, and myself, we all work with adults and do a range of issues: voice, swallowing, speech, language. So we cover the gamut and would be happy to help with any kind of speech language pathology issue. And we've mentioned this a little bit. I don't know if Leah wants to chime in, but I'll just say, as we said, we have just opened a new clinic, and with that was a huge investment for making sure that everything is current evidence-based practice, so that we are teaching students, and we do involve students. As when those of you online, you can't see, but we have 2 lovely students with us today, 2 audiology students. Brand new equipment and access to the most current technology. And of course, we are part of WVU Medicine, so we're able to both collaborate between speech pathologists and audiologists in our center, but also with all of the providers, within WVU medicine, which we absolutely do all the time. So I'll let Leah go ahead and chime in if you have anything else.
I think you got everything. We are definitely ready to answer any questions that anybody has online or in person. We're here to answer any questions. Oh, and we have the surveys that I had briefly mentioned before. Christina brought one.
And I forgot to mention those. So we have surveys that will be shared with you. Sometimes it's hard to know if what you're experiencing is actually a quote unquote problem, right? So, okay, sometimes I cough a little bit when I'm eating, or maybe sometimes in noisy environments, I have a little bit of trouble, but is it really a problem? Is it something I need to see a professional for? And we have surveys in our fields that help us determine if it is actually a problem for you. And that's what we left. So there's one for, there's one that relates to hearing. There's a survey that relates to voice problems, and there's a survey that relates to swallowing problems. So it just will help you sort of reflect on what you might be experiencing and, determine if it's, problematic enough.
And I'll be emailing that out to everybody as soon as this is over. So are there any questions? If not, if there's not a burning question at the top, I could start off with one. Okay, so let's say I'm having some hearing problems, or I think I'm having some hearing problems. What are the steps? I look you guys up, I set up an appointment, and then what do we do?
Where do we go from there?
Where do we go from there?
It's a great question. So first you give us a call and you'll speak to Melissa, who's our front desk person, and she will get you scheduled. It'll either be with myself or one of the other two audiologists, most likely with me because I am in there full time. And we'd start with talking to you about what you experience, finding out a little bit about your medical history, talking about your noise exposure and just sort of what brings you to see us. And then we'll dive into a comprehensive hearing evaluation. So if you can picture that slide with the ear from before, we're going to test that whole system from the outside in, from the part of your ear that you can see all the way to the part of your ear that we can't. After that, we would talk about, oh, sorry. Oh, thank you. Thank you. We'll work our way from the outside in, and then after we have all the information, we would go over it with you and discuss what sort of recommendations we would make for you based on what we found. There is no one size fits all for treatment when it comes to difficulty hearing, and not just technology is the answer. We do put a heavy emphasis on talking about strategies that you can use in your environment, because at the end of the day, if we could give you back normal hearing, if there was a pill I could give, I would leave them out in a bowl on the front desk, right? There's more to the story than just, flipping a switch. And so we would kind of walk all through those steps with you, decide what you need from there. The question is, how do you treat tinnitus? And that's a very good question. So as of right now, I love the way that question is phrased, let me first say, because I think that what most people wonder is there a cure? Is there a way I can turn off this sound? So for those of you who are unaware, tinnitus is the perceived sound. It can be a high-pitched ring, it can be a buzz, it can be a roaring, it can be a number of things, but the clarifying piece is that I hear it, but you don't. It's completely subjective in that you tell me you hear it. I can't test if you have it or not. And it can sometimes be associated with hearing loss, but not always. Some people who have mostly normal hearing or normal hearing have it. My husband will argue you have hearing loss in your ultra high frequencies that we don't test for clinically, but that's another story. But at the end of the day, the way that we treat tinnitus is teach you how to manage it. So the example I like to give, because it's auditory, is when you're driving in the car, the road noise is constant. You can hear it if you listen for it, but because it's not important to your driving, you can ignore it and focus on a conversation. You can listen to the radio, you can drive effectively. However, if you hear something that is new, you're going to focus on that. Maybe it sounds like something is on your tire, or maybe, you know, there's a road noise that's abnormal. All of a sudden, that's going to grab your attention. What we do is we try to help you manage how you react when you hear it, in hopes that you can focus on other things. And there are lots of strategies associated with that. Depending on how bad you experience it or how severe you feel about it, might dictate where we go in terms of treatment. There's just no known cure at this time. One of the reasons is we don't actually know where it generates from. So we can't target treatment, but like I mentioned, I know a guy who's researching how to test for this sort of thing. So if there's a place to go for tinnitus treatment, it's certainly our clinic.
Is this a free service or do you take Medicare? Oh,
I was just about to ask that, Joanne, like what's the payment fees? How do you pay for it, et cetera?
That is a great question. Thank you. We do accept insurance. And so when you go to schedule, that will be a conversation that you can have with Melissa about what services are covered. It's, I believe we do accept Medicare.
Yes.
And so, yes, it is a transition for us. The WVU clinic, if you know somebody who used to be going to the clinic over at Allen Hall, they were not accepting insurance in that clinic. We have transitioned in this new brand new clinic that Christina was telling us about under the School of Medicine that now does accept insurance.
And I just wanted to say a note about that, because I know that can certainly be a concern. But everybody that comes through the clinic, we get what's called a pre-approval. So, okay, everybody who comes through the clinic, we get pre-approval, which means that you know, we wouldn't see you without knowing if it was covered and knowing, you know, what that, you know, that you would need a copay or whatever it would be. So, you know, you wouldn't go through without being knowledgeable at that. And Melissa, again, who is our front desk person, takes care of those phone calls. So you don't have to get pre-approval. We do that. So if it's something you would go to WVU Medicine for, it's something that you could come to us for.
so that the information would be on my chart. It's in School of Medicine. Are you familiar with my chart?
Yes, so we do. We can interact with my chart when we have televisits, which I actually don't know what you do with audiology, but in speech, we do televisits and, you know, have interactions through my chart. But yeah, we are absolutely interacting in that same system.
Great, thank you.
Absolutely. That's a really great question. What's interesting is I believe what you're describing is called hyperacusis, a sensitivity to loud sounds. The treatment for hyperacusis can often be wearing hearing aids to desensitize to sounds in general. Now, it's obviously not you know, people aren't thrilled to hear that, but the treatment of using hearing aids with tinnitus is a little bit, I'm trying to think of how I'd like to say this. If you have hearing loss and you also have tinnitus, then a hearing aid will amplify where that loss is, and you're more likely to pay attention to things in your environment you weren't otherwise hearing than you were the tinnitus. If you have normal hearing, again, it's going to make everything a little bit louder around you, and it could just be an attention piece. But in the research, what has worked most effectively is something that can be seamlessly integrated into your life. So a hearing aid requires that you put it in, you wear it all day, you clean it, maybe you charge it or change the battery. It's going to add things to your life where if it doesn't work or if you leave it at home, you might miss it and therefore notice the tinnitus more. If tinnitus is the only problem you're working with, I tend to like to start with strategies and not jump right to a device. That doesn't mean a device wouldn't help, just my own personal opinion on how to strategize against that. In terms of the technology, they're prescriptive. The X's and O's that I showed before get plugged right into the hearing aid, and where you need more amplification versus where you need less treats those differently. It also treats soft medium, and loud sounds differently and has a cutoff point when things might get too loud. It's a measurement that we can take from you, what you consider comfortable. And all this to say, it's completely customizable. It's totally programmable. It's digital right on the computer. I often say less is more in terms of treatment, only because the more adjusting you're doing, the more attention you're giving it. And if the whole point is to focus on what's going on around you, then monkeying with your hearing aid can sometimes take away from that. But it's something that we would work on together. Does that answer the question? Okay, great. Thank you.
Yeah, speaking about hearing aids and devices and stuff, I know that those can be really expensive and sometimes Medicare will not pay for them. So I'm starting to hear about over the counter
Yeah.
devices. What are your thoughts on that?
It's a very topical thing right now. So the FDA recently sent out the first step in approving what's considered over-the-counter hearing aids. We haven't actually seen them yet, so it's hard to talk about them without knowing anything. But what I will say is that a hearing test will tell you whether or not you need something stronger, weaker. The cost is important to keep in mind, obviously. But if you spend money on something that's inappropriate for you, you may end up spending more money down the line anyway. So finding out ahead of time with just a baseline of what you're working with is, I would say, wise. I hope that if people are pursuing over the counter, they're doing their own research about what those are capable of. But at the end of the day, I know what I'm looking at with a hearing aid, and so I can certainly support anybody in their choice to go forward or not with something like that. We won't be selling over the counter. That's kind of the point of over the counter. But as more information comes out, we'll be learning it right alongside the consumer. And so, we'll be all in it together, so to speak. I like to think of it as the difference between readers and the glasses you get from the eye doctor. In that, readers might help you. They're going to make things bigger or clearer for you, but your glasses from your eye doctor have your prescription. That's kind of the comparison I like to try and frame it.
Are there any other questions?
Do we need a referral from our primary care physician to use your clinic if we're in the WVU system and insurance is involved?
I'm not sure. I believe it has to do with your insurance, whether or not you need a referral. So that might be a question for the insurance company directly. I'm not positive if every insurance requires a referral.
But again, so if you were curious about, getting a hearing test or something else, and you just wanted to contact us, Melissa, our front desk person, would let you know. That's actually part of what we do routinely when we get information about, people who may want to see us. We figure out, do you need a referral based on your situation and insurance? So it's case by case.
And we'll include the clinic's contact information when I send out the email with these surveys and such. So you guys will have that information as well.
And I think I'll speak for both those, but I think we're leaving our contact information as well, mine and Leah's. And if you have questions, not even about the clinic, but just about these topics, and you're not sure about something, we're happy to hear from you and happy to answer questions. And our information's on those cards.
Any other questions? If not, I guess we're wrapping up a little earlier today. Thank you so much. This is really informative.
We're happy to be here and happy to answer any. If you think of something, I should have asked, please don't hesitate. That's what we're here for.
Well, no more questions, no more last minute questions. Okay. Well, thank you, everyone. I will get this email out to everybody this afternoon. So y'all have a wonderful day.